Back on Inside Tennessee, the Speaker of the Tennessee House is our guest, Cameron Sexton. Good to have you with us, Mr. Speaker. Thank you for making time before the session starts this week. I want to turn to Billy with our opening question here at the third block.
Mr. Speaker, let me ask another education-related question. The Tennessee Supreme Court is expected to rule soon on a law passed in 2019 that would provide public funds to private schools in Memphis and Nashville. I believe you voted against that legislation. If the Supreme Court strikes that law down and Governor Lee brings back another similar bill to the legislature, will you continue to be opposed to providing public funds for private schools?
Well, I mean, I think on that bill, the reason I voted no is I think that having it just in 2 counties and limiting who can use it was an issue, as well as it being school choice. It'll be interesting to see over COVID with what some of the school systems in our state have done to see if public sentiment has changed on school choice. I would assume that there's probably more support for it today than there was 3 years ago. The idea that I've talked about with the governor is we do have an issue, because when I've traveled to other counties, and mostly where charter schools are, Shelby and Davison, you have the same kids who are failing in the school system who go to a charter school with different leadership, different teachers, a different philosophy, and they thrive. And now they're going to college, and now they're being successful. So it's not an issue about the student not being capable to get to that point. It's really about that school system. Why are they not doing the job that charter school is doing to help that kid get ahead in life? And so I think when you look at it, one of the things I would talk about is achievement school districts, which are the worst of the worst schools in our state that the locals couldn't turn around. There was a study done that just showed that the state couldn't turn them around. And so why are we sitting here going back and forth saying who wants it, local, state, local? Why not let that be the pilot program for school choice and allow those parents who have those kids who have been in those school districts for decades to take their money and go somewhere else and see if that works? I think that would be probably the best start if we're ever going to go to the school choice. It's not debatable. It's not unconstitutional, because we all agree on what the achievement school district is. And then let's move forward on that and see what happens. But, we'll see what the Supreme Court says. It's a close vote right now.
I'm going to borrow from Billy and ask you a philosophical question based on your history of serving on health committees in the legislature. When you look at health care, do you believe that basic health care in this country is a fundamental right, or is it a responsibility for citizens?
It's a responsibility for the citizens. The employer, it's not the employer's right to offer you health care insurance. I think when I've talked to physicians, the problem that we've had is when we went from the model that we had into the HMO model, and the insurance now is starting to dictate. And what you have is, we all want affordable, accessible health insurance, but it's not, because you have the insurance companies own the PBMs, they also own the pharmacies, and now they own provider practices, and they have the whole marketplace. And so what we really need to do is have healthcare reform and really talk about what is a basic healthcare policy. We know when you go buy car insurance and you say, I want the basic car insurance, what that means. In healthcare, you could have 5 people and you all disagree on what a basic policy is and what affordable is and what accessible is. And so we really need to have better conversations about what healthcare is. But the healthcare policy originally was meant for life problems in the end, whether it was a cancer or big items, not for the ways that it's done now. But it's not a right. I don't think healthcare is a right.
Let me ask you about the state of Tennessee's healthcare, and this is from the Tennessean back in 2018. Tennessee ranks worst than the national average for adult diabetes, poor mental health days, obese adults, and low birth weight babies. That's according to data from the Sycamore Institute then. And at that time, Richard Johnson, who's the CEO of the Governor's Foundation of Health and Wellness, said, frankly, looking at the statewide numbers, we're not that different from where we were 5 years ago. How about in 2022? Have you seen much of a change? And is it government's responsibility to help make that change?
Well, I think that's almost like the whole conversation around COVID as well, right? Between, does government force you to do something, or do you take the responsibility to make that decision for yourself? And, I think when I talk about COVID, we really need to start talking about, to your point, John, about how to become a healthier state, how to be a healthier population. Because we know who COVID attacks, which is those immune compromised people, people who are obese, different types of patients, which we know our population is at high risk. And so we really do need to have a conversation about how to become a healthier state. Just because you have health insurance doesn't mean that you're healthier. I think that's a misconception that people think as well. And so, we need to have a better idea, better conversations about our portions in the South are huge. They're not normal portions. And so let's have a conversation about how to become healthier. But we also need to invest in mental health and substance abuse, because what we're doing in this state right now is we're waiting for a crisis to happen at home, jerking those people out, putting them in the hospital with a police escort, then moving them to a facility, breaking up the home, breaking up the kids, spending money from DCS, DHS, Teen Care, everywhere else after the fact. Instead of spending the money after the fact, let's put the money in before it happens and have people get help with their substance abuse and their mental health so that they can be productive citizens and get on the track. I think that would be a big thing. Also, in the children's population, oral hygiene is a big issue for determining how healthy they're going to be later in life. And so we really need to focus on oral hygiene too in those early years.
Susan, your final question for the speaker.
Yeah, this has been a very strong year for money and revenue coming into the state of Tennessee. Plus, we have the federal dollars that we'll have as one-time money. But has there been any discussion at all about tax relief? You all have done a lot of tax reform since you've been there. For instance, the privilege tax, are you going to take that away? And there's, I think, 7 professions still that have to pay the privilege tax. But are you discussing tax relief since we've had such great tax revenues?
There has been discussions about tax relief, whether it's the professional privilege tax. I think there needs to be a tweak to the F&E tax on businesses. We're a little higher than the surrounding states. I think businesses need some additional help, especially during this time. But one of the things, Susan, I'll say is we're very careful about the inflation in America right now and what's happening. And then with interest rates probably going to rise sometime this year from the Federal Reserve. Because when you have a $30 billion budget and inflation's running 5 to 6%, that's a lot of extra money that you're going to have to come up with. And so we're still going to be budgeting very conservatively as we go forward, just like Governor Haslam, who did a great job for us those first 8 years of before Governor Lee, and now Governor Lee here 3 years in. And so our state's very well off, and we're doing a great job. And hopefully we'll be able to provide some tax relief, but we're also very cautious about what the inflation looks like.
Only 30 seconds, Mr. Speaker. Do you have any designs to run for governor?
Well, I'm going to support Governor Lee here this year. I'm going to do everything I can to get him elected. I think he has done a fabulous job. He was the right man at the right time. And the future, you never know what happens in the future. You never know. But I'm enjoying where I'm at. I think I'm doing a great job working with Lieutenant Governor, who's a great friend of mine and a mentor of mine, and Governor Lee, and I'm enjoying that immensely. And then we'll just see what happens in the future.
Mr. Speaker, we're grateful for your time today and best of luck at the start of the session. Thank you, sir, and we hope to check in with you once again as you get things rolling in Nashville.
Thank y'all. Go Vols.